All right, so I on my MAR have an order from Dr. B for Mr. Bobby Owen 1111 for Practivile 30 milligrams to be infused over 20 minutes. So I'm going to check that here, which is my first check. I'm going to administer this by the 6 rights, right? Patient, right. Route, right. Date, right. Time, right. Medication, and right. Documentation afterwards. I'm going to come into my medication room, where is also a MAR, which is unfortunately going to be back there. I'm going to wash my hands in the medication room and dry my hands. I'm going to go ahead and withdraw Practivile from the dispensary and check it with the MAR, which it is Practivile. Practivile in this is 10 milligrams per milliliter. So I'm going to go ahead and set my withdrawn Practivile. Excuse me. I'm going to select the correct solution for mixing the Practivile, which is 50 milliliters of normal saline, which is what you dilute Practivile in, obviously. I'm going to make sure that this is going to be able to be given to the patient and check it with the patient's weight and make sure that the patient's condition is right for this and make sure there's no contraindications for the patient. I'm going to check my solution, which it is in date, July of 18. I'm going to go ahead and throw that over here. And I'm going to make sure that it's a clear solution and that there's no floating particulates or anything like that. And I'm going to select a 3 milliliter syringe. Since Bob O has 30 milligrams of Practivile ordered, I'm going to use a 3 milliliter syringe to draw 3 milliliters of the solution, which it's 10 milliliters, or 10 milligrams per milliliter. I'm going to go ahead and throw the cap over there, and I'm going to my alcohol swab. Set that there. I'm going to scrub the top here, let it dry. I'm going to set my alcohol swab as a clean location in case I need to set anything down. I'm going to pull up 3 milliliters of air. I'm going to remove the cap and set the cap right there. Instilling 3 milliliters of air into my vial. Turn my vial over. Pull 3 milliliters of Practivile solution out. Right there. Okay, that's a little bit more than I need. I'm going to get any air up to the top of the vial, and I'm going to instill that air in there. All right, 3 milliliters, like that. All right, I'm going to set that down there. And I'm going to go ahead, cap my needle for now. And I'm going to set that right there next to that to mix. Since the Practivile is a multi-dose vial, as Practivile is, everyone knows, I'm going to go ahead and take a label and label the Practivile with my initials, today's date, and the amount that I pulled for now, and set that back into the dispenser. All right, I'm then going to go ahead and open that another alcohol swab, and I'm going to swab the installation port on the solution. Let that dry for 30 seconds. I'm going to open my 3 milliliters of Practivile solution and instill that slowly, making a nice pleasant sound into there. And I'm going to go ahead and lay that on a clean site, and I'm going to walk this, excuse me, over to the sharps container. Go ahead, and then I'm going to dispose of this nice cap right there. And I'm going to go ahead and mix that by turning it, not shaking it. Then I'm going to label with my proper labeling right here that I have Practivile, 30 milligrams into the solution. All right, then on a completely different pole than is in the actual patient's room, because I am not currently in the patient's room, I'm going to go ahead and put my Practivile solution. I'm going to open a secondary medications set, which is 10 drops. I'm going to pop those off. Dispose of them. Going to close the roller clamp. Going to set that for dropping it over there. And I'm going to go ahead and put that right there. And in interest of keeping things clean, I'm going to set that right there. Put clean gloves on for putting in the administrations. All right. The roller clamp. I'm going to makes a very satisfying noise. Remove the protective cover and using aseptic technique, introduce that and fill up the drip chamber. Drop the drip chamber down. All right. Go ahead and prime the tubing. Alright, and then I'm going to pull the solution off of that in the med room. And I'm going to grab that guy. This is a 10 drop. I need to take that out for the patient's room now. Alright, I'm going to go ahead and walk down to room 1111 into Bobo's room. And I'm going to knock on the door and open it for privacy and whatnot. Enter Bob's room. Hi, Bob. It's Bobby. As I'm in Bob's room. All right. Dr. B ordered some Practivile medication for you. So we're gonna go ahead and get that set up. That's an infusion. Gonna go ahead and give you the reasons that you're getting that, and why that's going in an infusion. And I would also give you any concerns why as you would be receiving that. Hey, Bob, I'm going to have you go ahead and give me your name and date of birth again. Bob O. 1/1/1965. All right, thank you. I'm going to go ahead and prepare that with the MAR to give that to you. I'm going to go ahead and scan that and scan your bracelet. That. The MAR. Check that. Proactive Isle. It is scanned.